If you've got back pain, you look up information, you'll see stuff about misaligned vertebrae, bones out of place and subluxations. It can be a bit confusing, so in this video I'll share with you in plain language what really happens and what really needs to be done to fix it. Now when you hear misaligned vertebrae or bones out of place, you get the picture of a stack of blocks with one going sideways. Then the chiropractor pushes it back where it should be and it's all fixed. Well, let's look at what really happens. Now we'll start with what's normal. As this diagram shows, when you're standing straight, all your vertebrae should sit nicely balanced on top of each other. And when you bend, they should all move about the same amount. That way you get a nice full movement with all the joints sharing the load. You get problems with your back when individual joints stiffen up. When they do, they're not able to move freely and often sit a bit tilted or twisted. In this example, the bottom vertebrae is tilted slightly to the left and not able to move freely. Now that's fine if your bottom joint is tilted to the left when you bend to the left. When your spine is straight though, you can see the bottom joint hasn't tilted back to neutral, so there's a bit of a kink at the bottom. You get the really big problems though when you try and bend to the right. As you can see, the bottom joint is still stuck to the left and there's a hell of a strain on the ones above trying to compensate. So, if someone talks about misaligned vertebrae, bones out of place or subluxations, that's what's really happening. The proper term is dysfunction, which is a technical term for abnormal function. So, why do joints stiffen and sit tilted? Well, they may be injured, subjected to repeated stress such as bending or twisting, or even held in that position for long periods of time by things like sitting at a computer. So that's what they are. Let's look at what they do to your body. Now I'll be mentioning various parts of your spine that can be affected, so first a quick introduction to their anatomy. Very simply, there's a column of bones called vertebrae, and between each we have discs. At the back we have little sliding joints that help to guide your movement. Now at the side we have little holes that nerves that come out. And finally we've got levers poking out the muscles attached to move the spine around. Now this diagram shows us the basic problems these dysfunctions cause. In this example, the bottom spinal joint is stiffened with the vertebrae tilted to the right. Now this can happen through either sitting for long periods of time or bending and twisting, so it's probably the most common problem I've seen in practice. Now we'll look at those red dots first. That's where the tilting of the vertebrae jams the small joints together. Now those joints were never designed to take that extra pressure, so when that happens they can become inflamed or easily injured. And of course if they stay doing that for a long time they become badly worn. Now when this happens it can start giving you pain, especially when movement puts extra pressure on those joints. Also, your body recognises this, so to prevent damage it will automatically tighten your back muscles to restrict movement, so your back will stiffen up. Now too often this is just treated with rest and inflammatory drugs and maybe injections. Now these may give temporary relief but of course do absolutely nothing to relieve the abnormal pressure on those small joints. So every time you do something again it flares up and of course the damage to your joints continues to accumulate. Now the next problem that tilting causes is it leans the spine above it, in this case to the right. Now when that happens your body automatically tightens the muscles on the left to pull the back straight so your spine is balanced. Now what that means is the muscles on your left will be constantly tight so they'll eventually become painful. Now when that happens, massage or stretching exercises are commonly used to relieve them. Now this will give temporary relief, but of course as long as the bottom vertebrae is tilted your body will automatically retighten them. In the pic before we saw there was a big problem when you tried to bend your spine to the opposite way the vertebrae was tilting. Now in this pic the bottom vertebrae is tilted to the right and the spine is trying to tilt to the left. You can see the bottom joint remains stuck and the ones above is bending maybe twice as far as it was meant to compensate. As you can imagine this is a disaster waiting to happen. That overworked joint is eventually going to be injured or deteriorate very quickly. Now what I'm going to do now is describe what I consider to be absolute stupidity. Now I showed you earlier when dysfunction is causing an ongoing damage to your spine, the back muscles tighten to minimise the damage. We've also seen now that when the joint is tilting one way, it restricts the movement in the opposite direction. Now with both of these, you end up with a stiff low back with restricted movement. Now, a sensible way to stop the back stiffness and allow proper movement is to correct the dysfunction. That way your body won't need to tighten the muscles to minimise damage, and the vertebrae will be free to move, so you'll get your normal movement back. Instead, what we get is people trying to restore movement and relieve pain by prescribing exercises, completely oblivious to what's happening underneath. Now, it may stretch the muscles a bit and compensating joints a bit to give some temporary relief, but those small joints that were being protected are going to start getting damaged again, and those compensating joints are going to be forced to move way more than they were ever meant to. Of course, the pain is eventually going to come back, but as I'll show you very soon, over long periods of time, that stuff causes severe damage and possible catastrophic failure. Now, one of the possible consequences is a disc injury. Now, as I've shown you, discs sit between the vertebrae. Now, structurally, they're a bit like car tyres, only filled with jelly rather than air. That allows them to squash down on one side when you bend. Now, just like car tyres, abnormal stress over time can cause the walls to weaken and the jelly inside starts to push through. Now, that's what's happened in this picture. Now, this can cause pain as the jelly breaks through the outer wall of the disc, or, as it shows in the diagram, it can press on a nerve. Now, disc problems are often caused by repeated abnormal stress such as bending and twisting. However, stiff and tilted joints can cause them too. Now, the obvious way is by forcing the compensating joints to bend way more than they were meant to. The not so obvious way is that stiffened joints destroy the disc through a lack of movement. Now, there's no blood vessels inside a disc, so it relies on movement to pump through nutrients. If it's not moving, there's no pumping. With no pumping, there's no nutrients. And with no nutrients, the inside of the disc dies. What I'm going to do now is show you how this stuff has happened on an X-ray. On this X-ray, the white rectangles are the vertebrae and the discs are spaces between them. In a normal joint, the space between the vertebrae is about the right thickness and it's even all the way through. That's a nice healthy disc. On the other hand, the abnormal one below, the space is much thinner on the left, which means the disc has deteriorated on that side. There's also a couple of things like parrot beaks poking out the side. Now, they're bone spurs, which are arthritic changes. Now, changes like that take a very long time. My guess would be about 20 years. In this X-ray, the rest of the spine looks absolutely healthy, but something has been putting extra stress on that one spot for a very long time. Now, the last issue stiff and tilted vertebrae cause is interference with the nerves. As I've shown you, they come out the holes at the side of your spine, and when the vertebrae tilt, it reduces the size of the hole. The space for the nerve can be further reduced by swelling from the joints, arthritic changes, and, as we've seen, disc bulging. Now, your nerves send signals to control your muscles and feel things like pain. Now, it's well recognised what happens when these signals are interfered with. However, most people don't realise that they also help control just about everything else as well. Now, because of this, back 100 years ago, chiropractors noticed that when they adjusted people's spines, sometimes seemingly unrelated conditions would improve. Now, they worked out that this would be due to removing interference from the nerve. You'd have chiropractors saying that if you had XYZ disease, they'd cure it. Now, those statements are still used to discredit chiropractors, but there wasn't the same scientific knowledge back then. At about the same time, medical journals were still telling doctors to cure people with leeches. Nowadays, all chiropractors understand that there are many possible causes of diseases, and the overwhelming majority would not be claiming to cure diseases, but would acknowledge that interference in the nervous system can cause the body to function abnormally. Now, with that in mind, checking the spine for potential sources of nerve interference is just as sensible as checking for things such as blood pressure and cholesterol levels. That's what stiff and tilted spinal joints can do. I've described them as being the cause of other problems, but the reality is that other problems can cause stiffened joints, so it's a bit more complicated. Regardless though, I believe that those stiff and tilted joints need to be considered central for three very important reasons. First, As a chiropractor for over 27 years, every patient with back pain I saw had at least one and usually more of them. Secondly, as I've shown, those stiff and tilted joints can cause other problems, and you can't fix the other problems without correcting the joints. Finally, and this is very important, look what happens when you correct the stiff and tilted joints. The muscles no longer need to be tight. The pressure comes off the overstressed small joints at the back of your spine. The overworked compensating joints no longer need to compensate. There's more room for the nerves to come out. And finally, if there are any arthritic changes causing problems, taking the stress off them may be the difference between being painful and trouble-free. So how do we correct those joints? Well, we've seen how not to do it, and that's with exercise alone. The only way to correct one of those joints is by applying a force directly to that joint. Now, this actually takes a lot of skill and training. The stiffened joint may be only stuck in one direction, so the force needs to be in exactly the right direction. Also, there's usually an overworked compensating joint right next to the stiffened joint that's maybe 3 centimetres away. The last thing you'll want to be doing is applying force to this joint that's already overstressed. Now, applying these accurate forces is a core expertise of chiropractors who call these procedures adjustments. Now, other professionals such as osteopaths and therapists with special postgraduate qualifications have expertise in this as well and use slightly different terminology. Now, as well as inducing movement specifically into the stiffened joints, the muscles and soft tissues around them will have changed and need to be restored. Now, looking at this picture we've seen before, we can see that the bottom space between the levers is smaller on the right and larger on the left. Now, over time, the muscles and other tissues between these levers changes in length to adapt. So in order for the joint to go back to normal, those muscles and tissues need to change back again. Now, of course, it's a bit more complicated because you've got things like muscles that are deteriorated due to being tight all the time and others shortened, stiffened and weakened due to disuse. But I think you get the picture though. Things have to readapt over time. You can't just go snap, crackle and pop and it's all like new again. For things to go back to normal, you need those specific adjustments to help restore movement, supported by a program of rehabilitation. Now, I've discussed before that therapy such as massage, exercise or medication alone will rarely fix anything. However, they can be an extremely important part of the process of restoring a spine. As I discussed in an article on trigger points linked in the description, muscles that have been tight for long periods of time develop changes that can cause pain, but more importantly inhibit function and can prevent things from returning back to normal. And massage is an excellent way to help restore muscles. Now, we've seen that exercise alone will not restore spinal movement. However, as a result of dysfunction over time, many muscles and other tissues will have shortened and weakened. These need exercises to restore. Now, the way this is done is to gradually introduce exercises once chiropractic adjustments or similar have restored some movement. Now, if your spine is very inflamed, rest and medication may be used temporarily to help settle it down in order to allow correction to begin. Now, finally, if there is a catastrophic failure such as a ruptured disc pressing on a nerve, surgery may be needed. But too often though, surgery is done and the underlying cause of a catastrophic failure is ignored. Now, like the specific forces needed to restore movement, coordinating this process takes a great deal of training. Therefore, it needs to be managed by professionals such as a chiropractor, osteopath or a therapist with appropriate postgraduate qualifications. Now, that professional may do all those therapies him or herself or refer some of the tasks to other appropriately qualified professionals. Now, that's been my job for over 27 years in practice. What I'd like to do now is go over how our massages help make this process a lot easier and more affordable. Now, as I discussed in that article about trigger points, patients usually need a large amount of massage or soft tissue therapy over a long period of time. And if it's all done by professional therapists, it can be very expensive. And because of that, patients rarely get enough. Our massages allow patients to supplement their care with quality therapy at home, and that way they get all they need. Now the second and usually overlooked issue is that, as this diagram shows, the really important muscles that control the movement of the individual vertebrae sit very deep between the levers. Now, as well as being very deep, those levers might only be 1 centimetre apart. Now because of that, it's physically impossible for the massage therapist to dig in deep enough to massage them. And neither can a percussion massager that works by trying to drive their heads in. The only way to effectively massage these muscles is by using a proper vibration massager. Now because it's the vibrations that do the work, they can easily find their way in deep between those levers. Now if you're a practitioner watching this and haven't used a proper vibration massager before, here are 3 very useful pieces of advice. Now the first is by placing the head very specifically, you can direct the vibrations to the muscles that need it. For example, you can direct them at the muscles associated with the stiffened joint while avoiding the ones associated with the compensating joint. Secondly, those tight muscles can work against trying to restore movement. Now if you use a vibration massager on them before, that removes a lot of the resistance. Finally, with some movement restored, the vibrations will further relax the muscles and help stimulate the circulation and nutrients. We've also got chiropractic adjusting instruments that apply repetitive thrust into joints in order to free them up. Examples include ArthroStim and Impulse chiropractic adjusting instruments. Now, as well as having a much broader effect including the muscles, it's likely the vibration fan massage will further help restore movements as well. In practice, checks of movement before and after using the massager usually show an excellent increase in movement. Of course, we have no way of knowing whether the increase was caused by the relaxation of the muscles around the spine or a similar effect to the chiropractic adjusting instruments, or both. I'm just happy that the movement was a lot better. Now, if you've got any questions or comments, I'd love to hear from you, and thank you very much for watching. It's been most appreciated.